What if you already have a serious blood sugar problem and your doctor has never told you? Not because your doctor is negligent, but because the condition exists in a zone that standard testing often misses. A zone where damage is already accumulating to your blood vessels, your nerves, your kidneys, and your brain, while every routine checkup comes back looking normal. Researchers call it prediabetes, and among Americans over 50, it is one of the most widespread and most underdiagnosed conditions in modern medicine. Today, we're going to walk you through exactly what prediabetes is, why it becomes so common after 50, what it's silently doing to your body, and what the research shows can reverse it, often without medication. Because prediabetes is not a warning that diabetes might happen someday. For many people, damage is happening right now. Every time you eat, your body converts food into glucose, which enters the bloodstream. Your pancreas responds by releasing insulin, a hormone that acts like a key, unlocking cells so they can absorb glucose for energy. When this system works correctly, blood sugar rises modestly after meals and returns to a normal range within a couple of hours. But after 50, several things begin to change simultaneously. Muscle mass declines, and muscle is the body's primary site for glucose disposal. Less muscle means less capacity to absorb glucose from the bloodstream. Fat distribution shifts toward the abdomen, and visceral fat actively interferes with insulin signaling. The pancreas itself becomes slightly less efficient at producing insulin on demand, and decades of dietary patterns begin to accumulate their consequences. The result is insulin resistance, where cells stop responding normally to insulin signal. The pancreas compensates by producing more insulin. For a while, blood sugar stays in a normal range, but the system is under increasing strain, and eventually blood sugar begins to rise into the prediabetic range. Here's what makes prediabetes so dangerous and so commonly missed. Standard checkups typically measure fasting blood glucose, a single snapshot taken after an overnight fast. This measurement can appear completely normal even in people who have significant insulin resistance and whose blood sugar spikes to damaging levels after every meal. The post-meal spike is where much of the damage occurs, and it is rarely measured in routine care. The numbers are sobering. Research estimates that more than 96 million American adults have prediabetes, more than 1 in 3. Among Americans over 50, the proportion is significantly higher, and approximately 80% of those with prediabetes don't know they have it. They feel fine, their checkups look fine, and the damage continues. So what is chronic blood sugar elevation actually doing to the body? The blood vessels are affected first and most broadly. Elevated glucose damages the delicate inner lining of blood vessels throughout the body. This triggers inflammation, promotes arterial plaque buildup, reduces vascular flexibility, and raises blood pressure. Cardiovascular risk begins to rise well before blood sugar reaches the diabetic threshold, in the pre-diabetic range itself. This is why many people with undiagnosed prediabetes are already accumulating cardiovascular damage years before any diagnosis is made. The nervous system is highly vulnerable. Peripheral neuropathy, nerve damage that typically begins in the feet and hands, is strongly associated with elevated blood sugar, even at prediabetic levels. Tingling, numbness, and burning sensations that many people attribute to aging or poor circulation may actually be early signs of blood sugar damage. Catching and addressing elevated blood sugar early can halt or slow this progression significantly. The brain is directly affected. Research has found that chronically elevated blood sugar is associated with accelerated cognitive decline and significantly higher dementia risk. Some researchers now refer to Alzheimer's disease as type 3 diabetes, reflecting growing evidence that insulin resistance in the brain plays a central role in its development. The same mechanisms that damage blood vessels throughout the body also damage the small vessels supplying the brain, reducing blood flow and accelerating neurodegeneration over time. The kidneys and eyes are affected through similar mechanisms. The small blood vessels supplying both organs are particularly sensitive to glucose damage, with changes beginning silently in the prediabetic range, long before obvious symptoms appear. Now, here's the most important thing to understand about prediabetes. It is largely reversible. Multiple large clinical trials, including the landmark Diabetes Prevention Program, have demonstrated that lifestyle interventions can reduce progression to type 2 diabetes by 58%. More recent research has shown that with the right interventions, many people can return their blood sugar to the normal range entirely. Not just slow the progression, actually reverse it. The window matters. The earlier these changes are made, the more vascular, neurological, and metabolic damage can be prevented, which is why understanding this now, before symptoms appear, is so consequential. Number 1. Reduce refined carbohydrates strategically. The most direct driver of post-meal blood sugar spikes is rapidly digestible carbohydrate. White bread, white rice, sugary beverages, pastries, and ultra-processed snack foods all cause rapid glucose rises. Replacing these with fiber-rich alternatives, vegetables, legumes, whole grains, nuts, slows glucose absorption dramatically. Fiber is the key variable. A meal built around fiber-rich foods produces a fraction of the blood sugar impact of the same calorie load from refined sources. Eating vegetables and protein before carbohydrates at a meal has also been shown to reduce the post-meal glucose spike meaningfully. Number 2, walk after meals. A 10 to 15-minute walk taken within 30 minutes of eating reduces the post-meal glucose spike significantly, in some studies by 30% or more, compared to sitting. Muscle contraction during walking activates glucose transporters in muscle cells independently of insulin, allowing muscles to absorb glucose directly from the bloodstream. For people with insulin resistance, this bypasses the impaired signaling pathway entirely. You don't need to exercise vigorously. A gentle walk at a comfortable pace produces the benefit. Consistency matters far more than intensity. Number 3, build and preserve muscle mass. Muscle is the body's primary glucose disposal site. More muscle mass means more capacity to absorb glucose after every meal. Resistance training 2 to 3 times per week improves insulin sensitivity significantly and produces lasting improvements in blood sugar regulation. Research has found it to be at least as effective as aerobic exercise, and the two combined produce greater benefit than either alone. Number 4, prioritize sleep. A single night of insufficient sleep measurably increases insulin resistance the following day. Cortisol rises, promoting glucose release from the liver. Growth hormone patterns are disrupted. Appetite hormones shift toward increased hunger and carbohydrate craving. Sleep and blood sugar are directly connected. Addressing one improves the other. Number 5, ask your doctor about the right tests. Fasting glucose alone is an incomplete picture. Hemoglobin A1C, a measure of average blood sugar over the previous 2 to 3 months, provides a more comprehensive view and is more likely to catch early elevation. Fasting insulin levels can reveal insulin resistance even before blood sugar rises. If you are over 50 and haven't had these markers checked recently, requesting them may be one of the most important steps you take this year. Prediabetes is silent. It produces no obvious symptoms in its early stages. By the time most people are diagnosed with type 2 diabetes, research suggests they have had elevated blood sugar for an average of 7 to 10 years, years during which damage was accumulating and during which intervention would have been most effective. You don't have to be in that group. The changes that move blood sugar in the right direction are not extreme. They don't require a perfect diet or an aggressive exercise program. They require consistency with a small number of high-leverage habits, applied now before symptoms appear. If this was useful, hit the like button. It helps more people over 50 find content like this. Subscribe so you don't miss what's coming next. And leave a comment below. Have you had your A1C checked recently? It may be the most important number you're not tracking. We'll see you in the next one.